The Delta State government has flagged off the enrollment of students in the state's 9 tertiary institutions of learning into the State Contributory Health Care Scheme, beginning with the Osadebe University in Asaba. The exercise tagged Students Contributory Health Scheme flag off at the university campus in the state capital and will see about 5,000 students of the institution enrolled by the Delta State Contributory Health Commission into the scheme. The health policy will cover illnesses from malaria to surgery, according to the Director General of the Commission, Dr. Isaac Akpoveta. The Director General further revealed that Delta State is the first state in Nigeria to provide health insurance scheme for its students, and it can be accessed on campus and when they are on holidays through any registered healthcare facility in the state. He also disclosed that the Delta State Contributory Health Scheme is the only state-owned health scheme in Nigeria that has 30% of her population, about 1.8 million subscribers, enrolled in the scheme. On his part, Dr. Austin Obidi, Chairman Governing Board of the Commission, highlighted the importance of the health of students to the institution and state government, while the Vice Chancellor of the Osadebe University, Professor Ben Ogo-Jaffor, represented by his Deputy Vice Chancellor Administration, Professor Chukwudi Christopher, encouraged all students to subscribe to the health insurance scheme. Quest Charles Kosipri reports that some of the student subscribers, Napoleon Dubisi and Atuva Precious, appreciated the government gesture for making a dream come true for students.
Precious with me, on behalf of the Delta State Contributory Health Commission, it's a pleasure to hand over to you your card, which is your access to our services. God bless you. Congratulations.
To test the efficiency and effectiveness of our ICT system, we have just registered and print out the access card of some of the students. Our teaching is Tertiary Institution Studio Health Insurance Program, developed by the National Health Insurance Agency, and to ensure that all students in this country enroll into health insurance. Because with health insurance, you protect your future. Delta State always want to take number one, and we are number one. We have been able to take it off here, domesticate it. And today, you can see the crowd of students assembled together. We have about 5,000 students in this university who will be enrolled into the scheme. And the advantage is numerous. One, we will return what we call capitation, part of the money they are going to pay, back to the school clinic, and that will enable you to be upgraded to a standard healthcare center for the students. They receive their care within the school premises. In addition to that, the access card will enable them to be referred for higher treatment anywhere else. And the treatment involved from malaria, typhoid, pneumonia, down to surgery, appendectomy, herniorrhaphy. In fact, it takes care of about 80% of the health need of Deltans, of anyone at the city. So you can receive this care in any of the centers. Surprisingly, it's how much? 7,000 naira. I want to tell you that the governor of the state, right from the is subsidizing, the government is subsidizing this. Ideally, it's about 18,000 per person per year. But the government, in its generosity of creating more agenda, that more people to receive more good things in Delta State, including health insurance, have sustained that value, small amount of money, subsidize it, and ensure that everybody can pay for it. And so, with 7,000 naira, they can receive care in the primary health care center in the school, any other hospital they are referred to, from simple treatment like malaria to complicated malaria to operations that can be handled. In addition, they are on holidays, they can also receive treatment in hospitals registered by the scheme. And if they are outside Delta, say we are making an arrangement for them to be able to receive treatment in Lagos, in Kano, in Akwa Ibom, as long as they have their card to present to a hospital registered by the health insurance of that state. In collaboration with what we call the portable portability, we can also assess. So it's a tremendous thing that is happening. And so we are grateful to the University of Osadebe University, Asaba, for taking initiative and being the first to do that. All the universities in Delta State will be there.
My bosom friend in medical school, he lost out in what we call our first professional exam, MBBS. Why? He fell ill and he had to be packaged back home. But thank God for we have evolved to a stage whereby, God forbid, we know in Africa we like to pray for what we know will eventually happen. God forbid if any of us, you students, you fall ill. Our commission, the Contributory Health Commission, we are there for you. Like your DPC admin rightly said, you scratch my back, you pay your premium, we will take care of you. University, I remember those days when we were matriculating, they told us that the university asks for us in loco parentis. I don't know whether that still holds. That the universities are acting as our parents locally. The university, as will be subsequently espoused to you, stands in a place to ensure that when ill health comes, rather than going to your village or to some other far place, you receive quality health care locally.
And everybody that had a stake in this institution is very, very important to us. That is why we say that because without students, I have no business being a vice chancellor, a deputy vice chancellor here. It is because you are there, that's why we are here. So your health is very, very important to us. That's why we have invited the state health officials under the Department of Contributory Health Insurance Scheme to come and discuss with us. And after discussing with us, the next stages of the process will be unfolded, and I want to appeal and encourage every one of you, the students, to take this seriously. Perhaps you have been keyed into a family NHIS or other contributory health schemes there at home, but because you are here, if you have any health issues, it may not be that easy for you to travel back home to say because you have a family doctor at home. It is here where you are that at least, let's take it, what we call the first aid will be administered to you. So it is when you key into this scheme that you will be adequately covered.
I'm very excited because so many times, like, we have sick ones in this school, and sometimes when we are not feeling fine, and this facility that the government has already created for us, we are very happy because we can also go to the medical and take some treatment to sustain us for the meantime. And it's also our privilege. These are the things the government we have been wishing to have for a long time. And I'm so glad to the government that have already provided this health care for us. I thank the government very much for this good opportunity they created for the students.